Welcome, everyone. Thank you for joining us for the webinar today. My name is Gina Breinig, and I work in the Health Promotion Department at the Health Plan. We believe each person's well-being is multidimensional, going beyond just physical health, which is why our wellness program focuses on 8 dimensions: emotional, environmental, social, spiritual, personal, professional, nutritional, financial, and physical. We are excited to offer a number of short educational videos on these dimensions and hope you are able to gain new knowledge and motivation to help you continue on your own journey to optimal well-being. Before we get started today, first some housekeeping items. We have everyone in listen-only mode for best sound quality, but there is a chat feature you can use to submit any questions. We will compile all the questions and send them out with responses to everyone after the webinar. This webinar is being recorded, so for those who are listening to the recording, there's an email at the end of the presentation where you can submit any questions. And now I'd like to introduce Janet Bollig, who will be speaking about preventing caregiver stress and burnout. Janet has a bachelor's degree in social welfare and a master's degree in social work. She is a licensed social worker in the state of Wisconsin and has a master's degree emphasis in gerontology through the UW-Madison School of Social Work. She has worked at Home Health through SSM Health at Home, Home Health United Visiting Nurse Service for over 30 years. Thank you, Janet, for sharing your information and your time with us today.
Thank you so much, Gina. I appreciate the opportunity to talk about this topic. What is a caregiver? I have to share, in my years of social work, many individuals don't identify themselves as a caregiver and just see themselves as a child or a grandchild that's having to provide services for their loved one. And when I address caregiving, it's usually only with those individuals that have found themselves in providing care for somebody else for an extended period of time. So really, what is a caregiver? It's anyone who could provide a physical or emotional care for an ill or disabled loved one at home. And it could be from any number of conditions or comorbidities, depending on that individual and what their specific care needs might be. That might include something physical, something medical, something in regard to mental illness, physical disability, perhaps even substance abuse or misuse in conjunction with other conditions. A caregiver can be anyone. And I would assume, really, when we think about all of us, anybody who's listening to this webinar is likely a caregiver. Maybe not currently, maybe in the past, but nevertheless, most people at some point in their life are a caregiver. So caregiver can be anyone. And again, most folks don't consider themselves as caregivers. But if we think of some of the tasks that caregivers will perform on behalf of a loved one, that might include some really general tasks that all of us have to deal with on an ongoing basis, such as buying the groceries and cooking and meal prep, doing the laundry, cleaning, any number of things and tasks here at home. And then also spending time making plans to help someone. So I can speak for myself. I have parents and I have other family members that I tend to check in on a very regular basis. So I'm always thinking about not only my own tasks, but again, the tasks for other people whom I want to help and are in a position of which I can. We may also be helping folks with dressing, showering, medications, obtaining home medical equipment, making sure that their overall needs are being met at home. Just for your information, caregiver statistics, they indicate approximately 43.5 million adults have been caregivers in the past 12 months. And again, these are people that are being asked who believe they are caregivers. So I would really assume that this number is even greater than that. We do know that the average age of a caregiver is 49, kind of that in-between age of having children or grown children, and also having that aging adult and perhaps even an aging grandparent. Higher hour caregivers are older on the average, so we indicate people that are caring for someone more expensively might be at that age of 52. Here's a really interesting statistic that over 56% of employed caregivers also work full time. So that 70% of working caregivers report work-related difficulty with their role. Of course we would. And this is why this topic of caregiving has become such a huge topic actually across the nation. You may have heard of some of these comments on the news or in certain media relations talking about how caregiving has huge impact on those people that are working. Half of the care recipients live in their own homes, and over 1 in 3 care recipients live in the caregiver's home. So again, this data is from caregiving in the US, but tends to be very relative to what we're talking about today in really looking at the prevalency of overall caregiving. Depending on your type of caregiving that you've experienced in the past, present, really depends on how you feel the level of stress. We know that caring for a close relative is more emotionally stressful for obvious reasons. So 45% with the spouse, 44% with the parent. If you're in a situation, yes, you might be dealing with both of these caregiving events. That's what makes it more challenging. Caring for those with chronic or long-term recipients is particularly likely to cause stress because we don't find that relief. We don't find that time frame in which we can actually be less stressed and be more carefree. And unfortunately, with those chronic conditions, which we see so much of, these conditions will exacerbate or get worse over time, causing that long-term stress. The higher hour caregivers, people who provide many hours of caregiving, are more likely to say that their health is fair or poor. And those are the people that might identify for themselves. But we do know that this is probably higher than that. People tend to have poor health status as a result of the stressors relating to caregiver assistance. And it does increase over time. I can understand people that might have aging parents that might be experiencing not only the medical and physical issues of a condition, but then we're also looking at those individuals with the dementias and related dementias, where we're dealing with a completely different type of caregiving need. And in many of those cases, that is 24/7. What you need to know, we all know that we're stressed, right, with the caregiving, and because we don't have a lot of control over that. And sometimes we might make the situation even worse by anticipating what their care needs will be in the future, resulting in feeling even more overwhelmed. If the stress of caregiving is left unchecked, it can really take a toll on your health and your state of mind, the relationships you have, your own energy, your own motivation, your own willingness to try and make things better for yourself. Some risk factors for caregiver burnout. And again, these are just some of many, but these are what we experience most often. We find that most of the caregivers are women. That natural nurturing effect of women, child rearing, childbearing, and having children and raising them. And then we tend to take on more of that nurturing role. There's also those caregivers who lack coping skills. If they've had difficulty in their lives and aren't able to identify the best and healthy coping skills, they're really going to have more challenging when it comes to caregiving. Many caregivers don't have information or lack adequate resources. And so perhaps we need to do more and more education, which, to be quite honest, I think is occurring more now than it ever has. Caregiving, as mentioned before, in the national level is being looked at primarily because of all those women and other caregivers working in their own fields or their own careers and having increased concern about caregiving. Most caregivers don't ask for help. If you've ever been in that situation where you have people that will say, please let me know what I can do to help, people are trying to share with you that they've identified that you might have a need for some assistance, but are not reaching out. This might be the most difficult for caregivers to experience. We must always encourage them that when people offer to assist them, that they take them up on that. Perhaps they identify certain things that they do need help with. Then there's also that co-residing or spousal caregivers. So again, people trying their darnest to work together to provide care needs for others. A good example of this might be a woman and her husband, and they both have aging parents. They both have responsibilities for each of their parents. And again, that spousal caregiving issue that can be more challenging for the entire family unit. Some of the things that one can look at to really identify some of the signs and symptoms of caregiver stress might include some of these. Again, it's not an exhaustive listing, but this is what you're going to start to see. Perhaps more of that anxiety and that depression and irritability, most likely leading to lack of sleep and just feeling overwhelmed. Feeling tired, again, and run down, goes without saying. Difficulty sleeping, anticipating what other needs need to be addressed the next day. Sometimes overreacting and certainly having trouble concentrating. Sometimes people will find themselves drinking or smoking or eating more just because that might be their coping mechanism, and neglecting some of their own responsibilities in the best interest of the person they're caring for. And in most cases, all of us will cut back on some of our leisure activities because that time frame needs to be used for caregiving responsibilities. So we're looking at the caregiver burnout, and you definitely over a period of time are going to feel that you have much less energy than you once had. Not only is that because of caregiving, but that's also all of us aging as well, and more of the responsibilities we might be experiencing. You are constantly exhausted. You start to neglect your own needs. And you find that your life really surrounds the caregiving of that other individual or group of people. You have trouble relaxing. You feel helpless and hopeless, wondering how you can continue to manage and trying to meet the needs of these individuals. And that you tend to get ill. Your immune system is down. You tend to catch every flu or cold or virus or what have you that's going around because, again, you are worn out. People will frequently ask me when I was out in the field, how do I deal with this type of burnout? And I think when one has experienced caregiving at an extreme level, you do get to a point where you find the releases, and being open to these releases is what's most important. We need to ask for help. I think most of us are always concerned about other people's lives and how busy they must be, and they probably are just as busy as me. Why would I reach out and ask for help? But when people make that comment of what can I do to help you, most people truly mean that. And so we need to be able to respond appropriately to them and tell them exactly what we need help with. I can always use a personal example here. I recall one time when a very close family member of mine was not well for several years. And I would frequently just take it all upon myself, and I would take care of everything, and finally realized all these people are asking me if I need help, and perhaps I do need some help. Perhaps it would be nice to say, please help me with my lawn work, or please just prepare one meal a week for me. Sometimes asking some very basic questions and asking for that help can mean a world of difference in your situation. Give yourself a break. Look at what you can do to provide for some me time. When I see me time, it's really taking care of yourself, looking at that exercise, good eating, pamper yourself, let you have that independence and that time to read or enjoy activities. And that needs to really be carved out of your routine to make sure that you are dedicating time to give yourself a break. We all need to practice acceptance and understanding that many situations occur and they're out of our control. So anticipating what the future might hold may not be a good idea because we don't know what the future holds. We can only manage what is presented to us at any given time. So if we accept that situation, accept what is happening, and look at what is the best way of providing support. In the meantime, as mentioned before, take care of your health. Make sure that you continue to go to your doctor, get your annual exam, make sure you continue to receive dental care and vision care, and really looking out for your own medical needs. That's how we're able to manage and stay healthy. And sometimes people might opt to join a support group. You would be surprised how many support groups are available in the communities in the state of Wisconsin and the areas that we provide service to. Any type of caregiving, perhaps it might be more related to a type of condition. Maybe it's an Alzheimer's or dementia support group. Perhaps it's a Parkinson's support group. Perhaps it's a caregiver support group. And so this is important to understand that they are available for you. You are able to seek out some of these support groups and really meet other support caregivers and perhaps obtain some information from them on how they manage their caregiver stress and burnout. So when you ask for help, I can't emphasize that enough. Speak up. Don't expect others to know what you need or how you are feeling, because each of us are very different in how we respond to situations, and especially how do we respond to the caregiving situation, and spread the responsibility. If there are several needs, we divide up those caregiving needs. Frequently, I would tell family members to get together and talk amongst themselves with the person whom they're going to care for. Identify your willingness and your ability to provide some assistance. Perhaps some people within the family are unable because of their current situation in their ability. Many times you'll find people are quite willing, but are they able because of their schedules? So if you find out who is available within your family, perhaps you can divide up those caregiving needs and develop a schedule. We just recently did that with a family member of mine, where we have several siblings involved, and we are looking at who can touch base with this individual on a daily basis and to make sure that she's getting that check-in every day. And that person then is responsible for getting what they need that day, perhaps making a visit, making those phone calls. It's much easier to know the person's being taken care of if you split up some of those caregiving responsibilities. We want to check in. We want to make sure that that person understands we're there to help. And if someone does offer to help, by all means, accept their assistance. This is what I struggled with for a very long time, and finally came to the realization that it was okay to ask. It made a world of difference in my personal circumstance. Be willing to give up some tasks, and this might be, again, some of those leisure activities or other things that you may have had previously. You might have to look at, what can I give up, or what is most important to me? Again, don't forget about yourself. And use community resources like the ADRC, which is the Aging Disability Resource Center, and the EAP, Employee Assistance Program, for help. Every community has an Aging Disability Resource Center that can offer different types of support programs, support groups, different types of caregiving, home care providers, all sorts of different caregiving assistance is available. We just need to seek it out. So give yourself a break. Maintain your personal relationships outside of work and caregiving responsibilities. Many times we'll put some of our personal relationships to the side in order to open up more time and ability to provide the caregiving responsibility. It's so important to maintain those personal relationships. You need to reach out, whether it be by phone or whether it be by writing or visiting someone over FaceTime, Skype, Zoom, what have you. Take time to maintain those relationships. Prioritize those activities that bring you enjoyment, because if your time is limited, you want to spend that free time doing what you really enjoy. Finding ways to pamper yourself. Sometimes it's that nice walk outside. especially maybe several times a day. Giving your time specifically for yourself. Finding a way to pamper yourself might include reading a book, perhaps going to the spa. One can always identify things that make us feel good. Make yourself laugh. Boy, I tell you, laughter is so important. And so many times we don't look at laughter to make us feel better. So find yourself in a position in which you could laugh. Perhaps it's with somebody that you really enjoy time with, and perhaps giving that person a call, and just again enjoying life and making yourself laugh, and definitely finding balance between work and other activities. I think as we age and we continue to be in the workforce, your priorities do change. We're all very, very committed to our work and love our work, but we also need to find that balance: work, family, and time. These are all hard things to try and balance, but as we try, we identify again those time frames in which we can commit to each one of those areas. We need to practice acceptance of what's being presented to us at any given time. Sometimes we feel very overwhelmed with current situations and ever-changing situations, and we feel and feeling powerless is the number one caregiving role. It's a very important role. It's a very satisfying role. It will make you feel good. It's a matter of how you interpret that role and how you approach that role, and looking at how blessed you are, for example, in being able to be available to care for that individual. Focus on the things you can control, and part of that is time, and part of that is restricting what you are doing, and again, looking at those other folks that can help you. Celebrating small victories. Perhaps someone is coming out of recovery from a surgery and it's been a trying time as a caregiver, but you're seeing that they're progressing through that healing, and you are feeling really good about what you've done. That is a victory that you celebrate, because your efforts do matter. Imagine how the person you are caring for would respond if he or she was able to. Perhaps they can't talk. Perhaps they know you are physically there and that you're providing what is needed. Imagine how much love that person feels, and how much satisfaction and appreciation they feel for your involvement. Don't forget that supportive friend or groups of friends are very vital throughout this journey. So taking care of your health, as I mentioned before, make sure you get to those regular doctor visits and your annual exam. The exercise, the meditation, or learning to meditate, eating well. Of course, we need to nourish our bodies with good choices. And of course, having that adequate sleep, because sleep is really what's going to make us find that energy that we need for every day. The joint support group, as I mentioned before, I have participated and facilitated support groups before. This is a great way of learning and educating yourself on other types of coping mechanisms, other ideas that have worked for other caregivers that might apply to you, or perhaps even learning more about the condition that your loved one is experiencing, that you can better understand what they might be going through. So again, seeking out those support groups, whether it be out in our communities or perhaps online. You have options both ways. If there's anybody who lives here in the Dane County area, the Aging Disability Resource Center actually has a caregiving association, and it would be to your best interest to join that. They are always sending out newsletters and online education, online guidance for those caregivers that cannot physically leave the home to attend. I like to leave this presentation with something that I read many, many years ago from Rosalind Carter. There are only 4 kinds of people in the world: those who've been caregivers, those who are caregivers currently, those who will be caregivers, and those who will need caregiving. So it comes down to, we are all going to be in that position. We are best to educate ourselves on how to best manage. I appreciate you all joining us today during this webinar, and I appreciate any questions. And again, please stay well.
Thank you, Janet. That was great information. And thank you to everyone who has attended today. If you have any further questions, please send us an email. Thanks again and have a great day.